Now, for the medical history for a chronic kidney disease patient, we'll just look at this aspect. Of course, it's trying to focus on the questions that you shouldn't miss, okay? The observations that you shouldn't miss out if you are handling a chronic kidney disease patient, okay? Of course, the signs and symptoms you are looking at for, some intelligent questions you're actually trying to ask for that time being. Now, for what we have, we said that taking a thorough medical history for a patient that has chronic kidney disease, especially in children, is very nice, okay, to help you to be able to have an idea that yes, this person actually has this issue. It will also help you to have a rough idea of the extent to how this disease condition has affected this patient. Do you understand? So for the medical history, first of all, presenting complaints, you should actually try to find out what is the main reason, okay, what is the main thing that actually brought the patient to the hospital, right? You try to get the patient to tell you more on how they are feeling, okay? Just create the flow, tell them that how are they actually feeling. All right, so here you're actually trying to make your patient very comfortable, do you understand, to open up to you. So you watch out for things the patient is saying. Are they saying they are weak? Are they saying that their body is becoming swollen up? Poor appetite, changing in urination, growth delay in children, nausea, high blood pressure. But sometimes, if you are dealing with a child, they won't really know all of this, do you understand? But their parents could actually tell you. You understand? So moving to the next, we said a history of presenting complaints. So, you are trying to look at the site, you are trying to look at the onset, when did it start. You are trying to look at the characteristics of the pain, do you understand? You are trying to look at radiation, is the pain going anywhere? You are trying to look at other associated issues. You are trying to look at the timing. You are trying to look at the exacerbation or relieving factors. Is there any stuff that is actually making it get worse? Is there any stuff that is actually making it get better? Then you are trying to also ask the patient that on a scale of 10, they should actually, stratify their pain. Do you understand? So, past medical history too. You are trying to know if this patient has ever had any issues before, particularly if they have ever had any issues in the kidney. So sometimes it's these issues in the kidney that over time they go for a very long time, then it becomes chronic. Then hypertension, diabetes, autoimmune disease, you are trying to also pick it up because those disease conditions could affect the kidneys. Okay, hypertension could lead to high blood flow, weakening blood vessels in the glomerulus. Diabetes could lead to deposition of sugar or glucose in the blood vessels in the glomerulus. Of course, autoimmune disease can also attack the body's own tissues. So you're also trying to know if they have ever been hospitalized or if there's any surgery that's ever been done for them. Then medical history, you see if they have ever been sick. Family history, you see if anybody in the family has gone down with any chronic condition or any kidney related issue. Then social history, you look at the diet and fluid intake. If it is a child, you look at the school performance, physical activity. You look at if they have been exposed to toxins. You look at their living conditions. Okay, do they have good water? So developmental history, that's for children. You are trying to focus on birth history, growth milestones. Did they actually hit those growth milestones at the right times? Did they have any issue while growing up? Then fluid status assessment. You are looking at if they are fluid overloaded or fluid depleted. Okay. Then you look at the different other systems. So other systems in the body, you are trying to see if there's any other positive stuff there. Do you understand? So cardiovascular system, gastrointestinal system, neurological system, dermatological system, genitourinary system. You are trying to look at all of that. Okay, so this is how you take medical history for a patient that has chronic kidney disease.